Well, you always remember the good case. And I still remember when we had a patient in the hospital who was not doing well. He was a man in his late 30s who was in for the infectious disease people. They had him in because he had lost weight, he had fevers, and they didn't know what was wrong with him. And this was pre the HIV era, just before it. And I was able to make a diagnosis that he had secondary syphilis on a biopsy done of a small macule on his body, and which changed the course of his diagnosis, his therapy, and his recovery. And this man ended up having multiple sexual transmitted diseases and also ended up with having HIV. So I still remember that because infectious disease people said, wow, a dermatopathologist can do that for us. That was probably the first one. The second one was being able to diagnose the first case of Merkel cell carcinoma in the skin at the Cleveland Clinic. Now, we are a diverse clinic, very well known, have 30 or 40 pathologists, and the biopsy came through dermatopathology, and I said, oh my God, this is the first Merkel. And we were able to make that diagnosis. This person went on to have systemic Merkel disease, carcinoma with metastases, but the dermatopathologist was the first one to pick it up and the first one to make the diagnosis that ultimately led to the diagnosis and treatment of that patient. So those are two just outstanding early cases that we made a difference.